Friends, I bring you greetings in these uncertain and unreal times, and I hope that all of you are safe and sound in your own homes with your families. One big question which all of us are facing nowadays is whether to conduct routine OPDs as clinical doctors, and if not, till when can we defer this? Now, there have been some guidelines, there have been some orders issued by different state governments, but what I'm going to say is not based on guidelines, but basically based on common sense. And the most important thing to appreciate is that given the existing circumstances, conducting routine OPDs is not a feasible option for most of us in individual practice. Although a limited routine OPD may be a feasible option in bigger government and corporate hospitals. First, talking of individual setups and small hospitals. Firstly, there is inadequate infrastructure, and the social distancing norms are difficult for any of us to maintain. And second thing is there is inadequate protection in case somebody turns positive. So, on one hand, as a clinician, you are under risk of exposure. On the other hand, there is a risk of becoming a nodal point for spread if one of your patients turns positive. And there have been instances where the entire hospital and the staff have been put under quarantine, and the setups hospitals have been closed down for this reason. The other problem is the stigma which is currently associated with this problem, and many people simply do not understand that this is not like plague or like leprosy of the yesteryears, where there should actually be anything like a stigma. So, unless things improve, I don't think that until this lockdown is officially over, there is much point in any of us running routine OPDs outside handling emergency cases or special circumstances, as the case may be. If you are doing routine OPD, for example, in a corporate hospital or in a government hospital, then there are well-defined guidelines which have now come in existence, and that includes all kinds of social distancing, use of the mask, use of sanitizers, and so on and so forth. And I don't think there is any need to repeat all that, because we all understand that well enough. Then there would be a question of doing surgeries, and if you start conducting OPDs on a regular basis, then you would be faced with the challenge of accepting or refusing surgeries. So I think the safest option at present is for at least all individuals and small setups, small hospitals, to continue to shut down routine OPD work. Thank you very much, and I wish all of you to stay safe and stay home.